everyone, I'm Dr. Shazma Mathani. I'm an ER doctor in Canada, and today we're going to talk about the supplements that could have a benefit on cough and cold symptoms. The first thing I want you to remember is that Health Canada and the FDA have not approved a lot of these supplements, so there's no level of regulation on the dose that you're getting or even the formulation that you are ingesting. So it's important to keep that in mind when you're thinking about taking these supplements. First, let's talk about vitamin C. So there is some evidence that vitamin C may reduce the duration of your cold symptoms. However, there's no evidence that it can prevent a cold from occurring. It is important to remember that too much vitamin C can actually increase your risk of kidney stones, so it's important to be careful with this. Next, let's talk about vitamin D. There's been a lot of talk about whether vitamin D can prevent COVID. However, there was a study done in October of 2022 that showed that there was no benefit of taking vitamin D for the prevention of COVID-19. There's also no evidence that it can prevent or even decrease the duration of symptoms of a cold. Next up is echinacea. Now, I remember growing up in the 90s hearing lots of buzz about echinacea preventing colds. Unfortunately, there have been a lot of studies since that time that have shown that echinacea does not prevent colds and does not reduce the duration of symptoms either. Let's move on to vitamin E. Unfortunately, there is no evidence for the prevention of cold symptoms with vitamin E or for the duration of symptoms once you do have a cold. Next up is elderberry. Now, this is one that still has a lot of mixed evidence for whether it is beneficial on preventing colds and decreasing the duration of symptoms. So the bottom line is the jury is still out on this one. There is very little harm in taking elderberry, so if it's something that you want to do, it's probably okay. I would recommend talking to your family doctor before doing so though. Next is oil of oregano. This does not have any evidence for the prevention of cough and cold symptoms or the treatment of cough and cold infections. It's not effective for any infections in humans either. I think a lot of the hype around oil of oregano comes from the meat and poultry industry, where it has been shown to have antibacterial effects in high doses, but this research is not applicable to humans and it has not been shown to be effective in humans either. Next up is homeopathic cough and cold formulations. There's actually no evidence for homeopathy in any circumstance, and this is no different. It does not work. Last up is zinc. Now, there is some evidence to show that zinc actually can reduce the duration of cold symptoms when taken by mouth. It's really important to remember not to use zinc nasal sprays because even at low doses, it can actually cause an irreversible loss of smell. That's it for today, everyone. I do have more segments coming up on supplements and the evidence for and against their use. So please be sure to follow for more and be sure to share. Until next time, take care.